Cases of Zika reported in South Florida, and the Zika infection zone is apparently growing. Correspondent Phil Keating is in Miami with a Zika update. Good evening, Phil.
Good evening, Brett. 7 new travel-related Zika cases announced today, and the number of locally transmitted cases spread by Florida mosquitoes now at 37. The CDC is advising all pregnant women to avoid the entirety of Miami-Dade County during their pregnancy, and the state is investigating whether there is now a possible third active transmission zone. That is in the very popular Brickell neighborhood south of downtown Miami, which is densely packed with condo towers, restaurants, and the city's financial district. Of the confirmed locally transmitted cases, 9 involve people who were not bitten by mosquitoes in the 2 identified zone, but elsewhere, leading to the suspicion that there's possibly a small cluster of cases here. On Friday, the state announced Miami Beach is now an active transmission zone, including most of world-famous South Beach, hotels, restaurants, and nightclubs. 15 million tourists spent about $24 billion there last year. In the artsy Wynwood district north of downtown, the first identified Zika zone, the state has been able to clear the threat from 3 small pockets within that square mile, and there have not been any new infections there in weeks. Today, also the first day of school in Florida. 9 schools sit within these 2 Zika zones, and unusually in Miami in a hot August, school kids were wearing long sleeves, long pants, and jackets, as well as plenty of mosquito spray. Republican Governor Rick Scott visited one of those schools this afternoon. He repeated his call on Congress to help.
This is an international issue. It's not just a Florida issue. We're at the tip of the spear because of our location, because of the number of people that travel to our state.
Democrat Debbie Wasserman Schultz also repeated the bipartisan Florida demands that Congress pass President Obama's full $1.9 billion emergency Zika funding request.
We predicted this for months, public health experts predicted it for months, and the Republicans have stalled and still haven't been able to appropriate the right amount of funding that public health experts say we need, and they're playing politics with it, and it's unacceptable.
Democrats and Republicans simply cannot agree on a final price tag for that Zika bill, so Congress hasn't sent anything to the president to sign, but much of the Zika battle really depends on all of the people, not only removing standing puddles of water around your house where the mosquitoes breed, wear protective clothing, and not only applying the repellent on your skin, but on your clothes as well, Brett.
Phil Keating live in Miami. Phil, thanks.
We're following some new developments on Florida's Zika crisis. Florida Governor Rick Scott says health officials are investigating 5 new cases of non-travel related Zika. One of those is in Pinellas County. That's on the Gulf side of the state near Tampa. People in the area can now get free tests for Zika in the state.
The other 4 cases are connected to mosquitoes in the Wynwood neighborhood of Miami, in addition to the other cases that have been confirmed in Miami Beach. David Begnaud joins us now by phone for more. David, what have you found out about the new cases?
Well, the Pinellas County case is important because it takes us outside of South Florida. So now we've got our first locally transmitted case. This is in the northern part of the state. There are several hundred, more than 400 Zika cases in Florida, but the large majority of them are travel related. So now you got one non-travel related in Pinellas County near Tampa. The question becomes, did that person get it because there is a new cluster, a Zika zone, so to speak, in the Pinellas County area, or did they travel to South Florida, or were they around somebody who did and had Zika? That's what officials are trying to figure out. Right now in Pinellas County, crews are doing door-to-door surveys where they ask you to submit to a urine sample, tell the health department if you're feeling bad. Even if you're not feeling bad, please submit to a urine sample because guess what, guys? Some of the people in South Florida who tested positive didn't even have symptoms of Zika, and they ended up having the infection when they were tested. Also down here in South Florida, 4 of the cases are in the Wynwood area. Makes it sound like it's brand new, but it's not. These are cases that date back to mid-July. The problem is those people also had symptoms of dengue and chikungunya. So what the health department did was check them for that, and it took several weeks to finally get confirmation they had Zika, and we're only finding out about it today.
David, this has been the worry that you've been reporting from local residents and officials for the last couple of days now. Should we expect more local cases like this to start popping up across the state and perhaps even other southern states?
I think you're going to see more cases of locally transmitted, non-travel related. Okay, we have 2 Zika zones, one in Wynwood, one in Miami Beach. Don't be surprised if you start having new Zika zones in other parts of Florida and along the Gulf Coast. Daily, we're hearing of new cases. But remember, some of these cases date back several weeks. because the testing is not as fast as people would like it, the public and the health department. Now, it's worth noting the Wynwood Zika zone has shrunk significantly, according to state officials who are continuing to narrow that box that they set up. The health department says there have been no active locally transmitted Zika cases since mosquito spraying began, and that was more than 3 weeks ago. I do want to tell you this. We're on Miami Beach right now, and we were just walking around with code enforcement, and I got to tell you guys, they are they are tough on people when it comes to standing water. We saw them roll down an alleyway. There was standing water that was dripping from a cement truck that was near a construction site. They handed out a $1,000 fine and went right on their way. They saw an air conditioner unit which was dripping water. It's 91 degrees here on Miami Beach. They walked up to the door of the person who the unit belonged to and said, here is a violation. You have 5 days to correct it.
Cracking down to try to prevent that spread. David Begnaud, thank you.
The need to control mosquitoes has never been more urgent. The Zika virus continues to spread across Florida.
But scientists believe there is already a solution, something that could wipe the virus out. Last night, the NBC2 investigators took you behind the scenes with scientists who have created genetically modified mosquitoes designed to get rid of the mosquitoes that carry Zika. The FDA has already given the company the green light. But NBC2 investigator Rachel Polanski uncovered a major holdup that could keep the mosquitoes from being released. Rachel.
Kelly, based on the FDA's recommendation, scientists with Oxitec could start releasing these mosquitoes as early as tomorrow. So why aren't they? Well, they chose a small neighborhood in the Florida Keys to conduct a field trial, and the people who live there are putting up a fight. Thousands of travelers wait in line to snap that perfect photo, standing in front of the brightly colored buoy. They chat, smile, and swat at mosquitoes. They're not concerned. Have you heard about the Zika virus at all? Yes, I have. Are you worried at all? No. They're at the southernmost point of the United States. They're living on island time. And just 6 miles away sits a small community surrounded by water with about 500 homes. Scientists have chosen Key Haven as their United States testing ground, and they want to release 3 million genetically modified male mosquitoes over a 6 to 9 month period.
If you release enough of our males over a long enough period of time, you can get the population to crash.
All of the GMO mosquitoes are Aedes aegypti. That's the primary species that transmits Zika. But these insects carry 2 extra genes.
One gene is a self-limiting gene that causes the offspring to die, and the other gene is a marker gene, which allows us to track and trace in the wild.
Oxitec has already released these insects in Panama, Brazil, and the Grand Cayman. It claims to have reduced the Aedes aegypti population by 90%. But many of the people who live in Key Haven tell the NBC2 investigators they don't care about the numbers.
They're using us as guinea pigs, I think.
Gina Fox calls it Jurassic science, and she doesn't want to be a part of it. What do you think about that?
Well, I think they're lying. I think they're just using us.
And she's not alone. I found dozens of signs that said no consent staked into her neighbors' front yards and posted on their fences.
Whenever you try to alter Mother Nature somehow, Mother Nature responds.
But not everyone is a skeptic.
I don't think that they would actually pick this neighborhood if they thought it was going to cause harm to all of us.
Residents will have a chance to vote on a referendum in November that asks whether they want these mosquitoes released. But the Florida Keys Mosquito Control Board will have the final say. Until then, the sun will set in the Keys as tourists snap a few more photos. Gina Fox will continue her evening walk, and the mosquitoes will be out soon, but she won't mind. She fears this new technology more than she fears the Zika virus. Now, if approved, Oxitec scientists say they can begin producing and releasing these mosquitoes within 6 weeks' time. After Oxitec has a successful field trial in the U.S., the company hopes to sell these mosquitoes commercially throughout the country. For the NBC2 investigators, I'm Rachel Polanski.
646 this morning, there are 545 travel-related cases of the Zika virus in Florida, 75 that involve pregnant women. There are 43 locally transmitted cases in the state. Well, now the Centers for Disease Control is working to send Zika preparedness kits to Florida hospitals and health departments. Those kits include bug repellent, bug netting, and standing water treatment tablets. NBC2's Christina Mendez is live from the Lee County Mosquito Control, and she spoke with an expert about how effective these Zika kits are in protecting you and your family from the virus. Christina?
Well, Zika preparedness kits are already being shipped to many health departments across Lee and Collier County. And this morning, I'm going to be showing you some of the recommendations they want you to use other than just your standard bug spray to protect yourself from getting the virus.
You can hear and sometimes see mosquitoes, but can you tell the difference between one infected with the Zika virus?
This particular mosquito is bright black and white, but so is our salt marsh mosquito, so you're not going to be able to tell them apart that way.
Lee County Mosquito Control says this is why it's important to protect yourself from all diseases the insect can carry, including Zika. Because of the recent spread of the virus, the CDC is now chipping in, supplying Florida with 10,000 Zika preparedness kits.
You just really want to make sure you don't get Zika, then the personal protection kit is going to give you that.
The kit comes with bug repellent, tablets you place in standing water to kill mosquitoes, and condoms since Zika can be transmitted sexually.
I'm glad to see that they're actually doing something to help us out here. It's a positive. I just hope it continues. I hope people use this stuff.
On top of using regular bug spray, the CDC is also recommending using permethrin, which is sprayed over the clothes as a second layer of protection.
Any protection is good. Any preparedness or something like that is good for anything.
You can find the Zika preparedness kits at local health departments and some hospitals. Lee County Mosquito Control says it's an easy precaution to take that's going to protect you.
The U.S. military and our USDA have done studies on repellent, and it can give like a 90% protection rate.
Now, according to a Mason-Dixon poll, nearly half of people living in Florida are concerned about the Zika virus, but Mosquito Control tells us that as long as you're using some sort of bug spray, that it will significantly lower your chances of getting that virus. This morning, we're live at Mosquito Control. Christina Mendez, NBC2.
The impact of Zika on most people who get it, it's often minimal, not even noticed. But if you are pregnant, the stakes are much, much higher since it's been linked to devastating birth defects. The CDC now says pregnant women and their partners, by the way, should avoid 2 neighborhoods in Miami where the virus has spread. So it is perhaps not surprising that a number of expectant moms in South Florida are changing their daily lives dramatically to avoid those mosquito bites. My next guest is one of those people. Amanda Paradis joins us now from Fort Lauderdale, from the confines of your home. Amanda, first of all, congrats on soon-to-be baby number 1. You're 17 weeks pregnant. Talk to me about the measures you are taking to avoid a mosquito bite.
All right, it's definitely been an interesting one. As you know, living in South Florida, it's extremely hot. I can't walk out of my house unless I'm covered from head to toe. So long pants, long sleeves, bug spray on the clothes, on the exposed limbs, you know, keeping it to a minimum, really, just to and from the car, to and from, you know, unless when it's urgent, if I've got to run an errand, I don't, you know, I won't not go, but just choosing wisely as to what it is that I'm doing every day.
So not only that, and mind you, South Florida, it's hot, so knowing that you're covering yourself from head to toe is not lost on me, A, and B, you live there in Fort Lauderdale. I understand, you know, you had a full-time sales job where you had to go to Miami quite a bit. You have altered your workflow to avoid that, yes?
That is correct. I covered all of Miami-Dade County for work, and you know, my husband and I had a lot of discussions about it, and we just didn't feel comfortable having me go there every day anymore. I did spend a decent amount of time outdoors, going to and from my buildings where I needed to be for meetings, etc. And it just wasn't a risk that we were willing to take. So luckily, I work for an amazing organization who is very respectful and accommodating, and they did give me a part-time position where I will be working from home. So big changes there as well.
So here's my question. Is this, all of these measures you're taking, is this from your doctor, or are you and your husband being overly cautious?
It's a little bit of both. I mean, you know, the doctor definitely looked us in the eye and said, you are at risk. There's no doubt about it. But this was more of a family decision, a family choice. It's just, it's not worth it to us. All it takes is one takes one mosquito bite, and our entire lives could be impacted. So this was the best and easiest decision for us to make, actually.
Final question, just quickly. I mean, what's the sense among people like you, moms to be? Because I see pictures of people still partying in South Beach, where Zika has been found. What's the sense among moms to be where you are?
I mean, it's frightening. I know that there's some moms who, depending on their situation, everyone's just doing what they feel is necessary. Some people aren't leaving the house at all. Some people, like me, are just covered from head to toe, even though it's 1,000,000 degrees outside. Some people I've heard, nobody I know personally, but they're leaving the state. It's really a scary thing. And, unless you are pregnant, I don't think you're thinking twice about it, because why would you really? But
what does your husband say?
He's actually, he was more concerned at the beginning than I was, to be honest with you. I don't think I realized the severity, probably like some other women out there, but we really just kind of came together, and once I started doing more research and realizing that there's so many more cases now, local cases, it really got me. And so, and him too, he walks the dog now. I don't walk the dog. He's also covering himself. He's wearing a hoodie and sweatpants, once again, 100 degrees outside, just to walk the dog, because he's got to stay safe too.
My goodness. 5 months to go, Amanda. Good luck. My best to you, and congratulations. Such a huge deal. Amanda Paradis in Fort Lauderdale. Thank you.
Well, of the many medical challenges facing the United States at the moment, one of the biggest is the Zika virus. There are now more than 2,200 confirmed cases in the U.S., and more than 500 of those patients are pregnant women. And the number of locally transmitted cases continues to rise as well, with more than 40 infections in the state of Florida alone. And for our nation's top doctor, well, the Zika virus is a personal concern. And to discuss it all, I'm now joined by Surgeon General Vivek Murthy. Good sir, thank you for joining us.
Of course, glad to be here.
I want to begin with the Zika virus, which seems to be something of a burgeoning crisis now, at least here in the state of Florida, as we're seeing more non-travel related, locally transmitted cases there. We've heard from Florida Governor Rick Scott saying that he will look to allocate as much as he can to combat the spread of the virus, while also saying that the federal government has essentially deserted the state. Is enough being done, and really what more can be done to get those almost $2 billion in funds that many seem to agree is required, made available to do what needs to be done?
Well, for a few things I think it's worth to establish first. One is that we are seeing more cases of non-travel related Zika in Florida. And this is a situation that we foresaw many months ago when the president asked for $1.9 billion to fund the Zika response effort. But I'm happy to say that Florida and the federal government, specifically the CDC, have been working closely together for many months to prepare for this moment. They've been working on public education, on expanding the availability of diagnostic tests, and on mosquito control measures. The question, though, is how are we going to continue these efforts going forward? And in particular, how are we going to continue vaccine development efforts? And that requires funding. And that's why it's so important that we act now and that Congress allocates that money. Because the truth is, we need to become a country that's better at acting early rather than waiting until problems become big and acting late. That's a shift in mentality that we haven't fully achieved yet.
And this is, there is a gestational lag to this issue, in that with regard to microcephaly and the severe impact it can have on babies born with it. The babies that might be contracting Zika, as you and I are speaking right now, will not be born until really the middle of next year. How to combat a problem that may not really make its face public for 9 to 10 months?
Well, you've hit on one of the great challenges when it comes to public education around Zika, which is that the concerns we are most worried about, the consequences of microcephaly and other birth defects, do not appear often for many months after the initial infection. But we want people to take this seriously so we can prevent future consequences. And that's why public education efforts are so important. It's also why it's important for us to look at what's happening in other countries. If we look at Brazil, for example, we've seen many cases of microcephaly there. So this is real. And that's why it's so important for us to make sure that everyone, pregnant women in particular and their partners, know the steps that they can take to protect themselves from mosquito bites and from sexual transmission of Zika.
Where is the vaccine production right now?
Right now, we have started phase 1 trials on a vaccine candidate. After that, we'll have to begin phase 2 trials, but phase 2 trials will require planning and financial support that has to begin right now. The Secretary of Health and Human Services, Secretary Sylvia Burwell, has already reallocated funds within HHS to support vaccine development, given that we don't have money from Congress yet. But that has come at a price, which is that we've had to take money away from other research efforts, including cancer research. That's not a good way for us to deal with a public health threat. And that's why what my hope is that not only that we can fund the Zika response fully, but also that we can set up a public health emergency response fund so that we're not in this situation in the future.
Another scourge really facing this country, and to which you are responding, I know, is the opioid crisis. You recently sent letters to some 2.3 million prescribers asking them to help. What specific actions then are you looking to have occur as we, again, combat something that really has so many regions of this country in its grip?
Yeah, so today, practitioners all across the country, 2.3 million of them, should begin receiving a letter from me about the opioid crisis. This is a letter asking them to join the national movement that we are building to turn the tide on the opioid epidemic. And there are a few key things we're asking practitioners to do. Number one, to sharpen their prescribing practices so that we are treating pain safely and effectively and not writing prescriptions for opioids that are not safe or necessary. Second, we're asking them to connect people who need treatment to that treatment. Right now, we have over 1 million people in America who need treatment for an opioid use disorder but can't access it. And third, we're asking clinicians to help us change how our country thinks about addiction. For too many people, addiction is seen as a character flaw or as a moral failing, but we want people to see it for what it is, which is a chronic disease of the brain that we have to treat with urgency, with compassion, and with skill.
For somebody perhaps casually sampling the news, they've seen that headline, the opioid crisis, the opioid epidemic. Just how dire is the circumstance?
This is one of the most pressing public health threats of our time. We have seen a quadrupling in the number of people who have died from overdose deaths since 1999. We have nearly 2 million people who are addicted to prescription opioids. And we have found now that the prescription opioid epidemic is contributing to the use of heroin and to the spread of HIV and hepatitis C. So this is an epidemic that is growing in its scope and in its impact. And just from a human perspective, I have seen families suffering all across this country as I have traveled on our Turn the Tide tour. I've met with parents who have lost kids to overdoses. I have met with husbands and wives who are struggling to figure out how to get their spouse into treatment. And even though there's a massive financial cost to this epidemic, what worries me most is the human toll this is taking on our communities. And that's why addressing the opioid crisis is a moral imperative, and it's one that has prompted me to send this letter to 2.3 million practitioners and also to build this larger campaign, Turn the Tide Tour, where we are urging doctors to go to turnthetiderx.org and join the movement that we're building all across America.
And you mentioned campaigns, it's election season. Healthcare has largely been reduced in the election cycle to either attacks upon or defenses of the Affordable Care Act. Are you hearing enough from Donald Trump and Hillary Clinton with regard to this issue, and what more perhaps could they and their campaigns do?
Well, to be honest with you, I've been focusing my efforts primarily on addressing the public health threats and not necessarily to listening to what candidates are saying right now. I'm certainly looking forward to working with whoever the next president is on addressing the most urgent public health threats that our country is facing. And those include opioids, it includes the challenges we have with Zika right now. But there are other challenges as well. You know, we are dealing with chronic illnesses in our country like diabetes and heart disease and obesity, which require a prevention-based approach. And as a country, we historically have not been great at prevention. We focus the majority of our resources on treatment, but we have an opportunity now to shift that balance, and that's what I'd like to do with the next president of the United States.
We've seen some breaking news today with regard to a medical issue, and that is the price for life-saving allergy medicines. It's risen nearly 500% in the last decade, but just today, just just this morning. Mylan, the company that makes the EpiPen, has announced that it is slashing patient costs amid outrage over these skyrocketing prices, looking to remove the burden, frankly, from parents and their families who need the medicine they provide. What do you make of the news we're hearing just this morning?
Well, high drug prices are a concern for millions of people in America, and I've heard this not just as Surgeon General, but when I was practicing medicine in Boston, many of my patients had difficulty paying for their medications, and I know that this is a real problem. What we saw recently with the price of EpiPens going up was just one more example of how drug pricing is a major problem in America. And that's something that we have to address. It's one of the reasons why I believe we should have the ability to negotiate drug prices with pharmaceutical companies when it comes to Medicare and Medicaid. But the bottom line is that people need relief, and they need relief in terms of drug prices and in terms of overall healthcare costs. I was happy to see that the company is today thinking about taking action to reduce prices. I would hope it wouldn't take an uproar to elicit that kind of response. But the bottom line is all of us have a responsibility, both a financial and a moral responsibility, to make sure people can get accessible, affordable care.
And here you are keeping these issues in public eye. Doctor, thank you so much.
Thank you so much.
Really appreciate it.
Great to be with you.
5, a local woman sounding the alarm. Zika is here in Palm Beach County, and she's proof.
They're kind of like, oh, there's no Zika in Palm Beach County. I have test results to prove otherwise.
The Lake Worth woman says she is the second local case of Zika in Palm Beach County. Tonight, she's speaking only to us and warning those in her community. News Channel 5's Michelle Casado with a story you'll see only on 5. Michelle?
Kelly, the health department is still trying to pinpoint exactly where the Lake Worth woman could have been infected. She claims she hasn't left Palm Beach County and believes she was infected around her Lake Worth home. For the last 24 hours, this Lake Worth woman, who does not want to be identified, has been answering questions from the state health department.
They want to know where, they want to know when, they're trying to track down a timeline.
A timeline of when and where the 24-year-old may have been bitten by a Zika-infected mosquito in Palm Beach County.
A lot of people were telling me that it wasn't a possibility, but it clearly was a possibility.
She says before she started showing symptoms, she noticed 2 mosquito bites on her arm, but living in South Florida, she didn't think anything of it.
I don't spend a lot of time outdoors, so literally it could have been just walking to my car.
Then the fever set in.
I had a fever for several days.
Rash, joint pain followed, all Zika-related symptoms she kept a log of. The health department sent her to get tested for the virus. The next day, she had to be hospitalized.
I could no longer walk. I was crawling, army crawling. I couldn't bend my hands.
She says the emphasis on locally acquired Zika cases happening only in Miami-Dade County caused doctors to doubt she could have the virus.
They were kind of like, oh, this isn't Zika, this isn't how it presents. So it made me feel like something more severe was happening.
On Tuesday, she found out she has the Zika virus.
The governor and people like that always thought that it was only in Miami, and I hadn't been in Miami.
This woman says she still feels weak and dizzy at times, but what scares her even more than what she's been through is what she doesn't know about the virus.
There's not a lot of information right now. Like, who's to say that if I were to get pregnant in 2, 5, 7 years, that this couldn't affect me.
The woman says today one of her neighbors was tested for Zika. Her 5-year-old daughter is also being tested. She says the health department has advised her to wear long sleeves and limit her time outdoors. In the newsroom, Michelle Casada, WPTV News Channel 5.
Today, Florida reported 5 more Zika infections spread by mosquitoes, bringing the total now to 42. One of the new cases is in Pinellas County on the Gulf Coast. That is far north of the 2 Zika zones in Miami and Miami Beach. So officials are trying to determine now whether there is a 3rd zone with active local transmission. David Begnaud is in Miami.
In Miami Beach, city sanitation crews spent hours looking for and vacuuming standing water. It's a breeding ground for Zika-carrying mosquitoes. We followed code compliance inspectors, also making their rounds, searching for standing water.
This is the stuff we're looking for.
They found it in an alley at a construction site. We noticed a cement truck dripping water. Officers Manny Villar and VG Maharaj took action.
We're going to issue a violation for creating a health hazard and nuisance, which is a $1,000 violation.
quickly, someone grabbed a broom and started sweeping.
As the citation was being handed out, let me show you something we noticed. An air conditioner unit where water is dripping. It's just a drip, but look at the puddle it's creating at the bottom. Something this small is exactly where mosquitoes would breed. But the problem code enforcement has is, what do you tell people? Turn off the air conditioner? It's 91 degrees on Miami Beach in the middle of August.
The inspectors gave the tenant a code violation and said he had 5 days to fix the leak or face a fine.
Hey, who do I report this to?
Erica Thomas is waiting for this type of action. She lives in the Wynwood Zika zone. Outside her high-rise apartment is standing water at a construction site. After calling and tweeting pictures to city officials, she didn't like what she was told, tweeting, "My situation in Wynwood will be handled in 24 to 72 hours. What a joke.
If you know anything about mosquitoes, that's a long time for a lot to happen.
An official in Miami-Dade County told us they know about that site Erica's referring to. They've treated it before, and they're going to target it again this weekend. Maurice, that new case up in Pinellas County, crews are now going door to door there, randomly surveying people. They want to find out if there's a new cluster of cases.
David Begnaud following Zika in South Florida tonight.
And meanwhile, the state of Florida is pushing for more federal funds to help fight the Zika virus and the burgeoning infections therein. There are now 37 locally acquired cases in the Miami area. The two Zika zones, if you will, are in the Wynwood neighborhood and another in Miami Beach. You see them there on the screen. Florida Governor Rick Scott says that he is allocating another $5 million to fight the virus in the area. But there is now growing criticism over just how the governor and Congress are handling the outbreak. Our David Begnaud has more.
What the governor did is he not only blindsided me, he blindsided our administration.
For the third day in a row, Miami Beach Mayor Philip Levine took aim at Florida Governor Rick Scott for failing to tell city leaders about Zika cases on Miami Beach before he notified the public.
I think it would be more useful in the future to let the elected leaders, let the administrations know what's going on so we can take the necessary steps